We're live on Facebook and we're also live on YouTube. Love 101 FM Jamaica. Sign on, rock on, roll on, jump on. Whatever you gotta do. It's time for some information that we need. Because dengue fever is going on. And to talk to us more about this, I have with me Dr. ANNEKE Blake. Now, dengue fever is an illness you can get from the bite of a mosquito carrying one of the four types of dengue virus. The virus is most commonly found in a tropical or in tropical subtropical regions, including Central and South America, Africa, parts of Asia, and the Pacific Islands. Now, today inside Body Talk, we will be learning about dengue fever with Dr. ANNEKE Blake. Hey, good afternoon to you, Dr. ANNEKE Blake. It's good to have you back again. Thank you for joining us for Body Talk. How are you?
I'm well. Thank you so much. How are you?
I am good. Thank you. How was your weekend?
Restful.
Restful.
How was yours?
What did I do? I went to St. Thomas, It was busy, but it was good.
That's nice.
Yeah, thank you. Now, Dr. Blake, what is dengue fever?
Okay. Dengue fever is a viral illness. Actually, it's called a flavivirus, transmitted by the vector, the Aedes mosquito. In our country, it's typically the Aedes aegypti mosquito that transmits it because, as you said, we're in the tropical zone, and that mosquito is particularly our vector. So dengue fever comes with a syndrome of particular symptoms that characterize the illness.
All right. So we're going to go to that in just a moment. You said it's called flavor.
Flavivirus, right?
Why they call it flavivirus? That's similar to flavor, and I don't like that. I don't like that at all.
It's just a scientific name of how they decided to name it many decades ago before we were born.
Okay, flavivirus. And it's always the 80s aegypti mosquitoes. I don't know what is it with those mosquitoes. I don't like them.
And it's the female mosquito as well that transmits.
Boy, females. Even in insects, boy, I tell you. Anyway, yeah. So you mentioned about symptoms and those things.
Yeah. So we can classify dengue as dengue fever. It can be normal dengue fever or severe dengue or hemorrhagic dengue. So the typical illness that most persons will have is characterized by a high fever, typically more than 38 degrees Celsius. We tend to have headache, joint pain, muscle pain. Some persons will have sore throat. You might also find that you have swollen nodes, for example, under the chin, along the neck. Some persons have reduced appetite, feeling very weak. Children might become a bit lethargic, not as active. So those are some of the more common. Some other symptoms, persons might have vomiting and nausea as well.
Oh my goodness! And we can experience any one of those symptoms or all of them.
Right. With just a dengue infection. You also have dengue with warning signs, which is a more severe form of the illness.
Really?
Right.
Talk about that one, no.
Well, if you have dengue with warning signs, you definitely need to go to the hospital for management. So persons with dengue with warning signs would have mucosal bleeding. For example, when they brush their teeth, they might see bleeding coming from the gums, might have spontaneous nosebleed, might notice bleeding under the skin. Some persons have blood coming out in the urine. Some persons might be passing blood in the stool. So typically they would have bleeding in that dengue with warning signs. Another warning sign is severe abdominal pain that is unrelenting. So children particularly might just be crying for belly pain, and no matter what you do, it doesn't improve. Also, if you notice that the vomiting that can come with dengue becomes persistent, so somebody who is vomiting multiple times in 1 hour
Yeah.
definitely needs to go to the hospital
Sure.
for management in that case.
Wow. Now, can persons get dengue more than once?
Yes, you actually can get dengue more than once.
Jeez.
Because as you mentioned before, you have four different serotypes of dengue.
Yes.
So that would be from 1 to 4. Um, if you catch one serotype of dengue, it confers lifelong immunity to that particular strain, and it does give you a limited immunity against all the other strains, but it doesn't pass 2 years. So if you catch dengue one, you won't catch that one again, but you can still catch
Two,
any of the other three.
yeah, two, three, and four.
Right. And
Right.
actually, that is how severe dengue comes in, because in cases of severe dengue, it's typically a person who had dengue before, recovered, and everything is fine, and then they catch another serotype of dengue, and then they have a more severe illness than the last time.
Wow. And can underlying illnesses, you know, affect it even more? Like, you know, like
Definitely. Healthy persons, young persons, tend to recover from dengue fever without progressing to dengue with warning signs or um, anything more serious. However, in persons who are more elderly,
mm-hmm.
persons with multiple illnesses, for example, persons with diabetes, persons
Right.
who have cancer, even pregnant women have to be monitored closely when they
Wow.
have a dengue infection, just because of the risk to themselves and, of course, the unborn baby.
Mm. No, I know it's spread by mosquitoes, Aedes aegypti mosquitoes, which I don't like those mosquitoes. I don't like any mosquitoes at all, right? So it can only be spread by mosquitoes, right?
Yes, by and large, that is the way how it is spread. So somebody who is infected with the
Right.
virus, has somebody who has previously been bitten by a mosquito,
Mhm.
a mosquito comes along and bites them, and then infects other persons via the mosquito bite. So that is why typically in communities or in household, if
Right.
one person has dengue, the other persons tend to come down with dengue in short
Yeah.
order, because that mosquito will feed on
Yeah.
multiple persons until its lifespan ends, and it typically tends to live for about a month thereabout.
My
So it
God.
can infect multiple persons during that time.
So persons who would have contracted that dengue fever, and say for instance, I have a friend. They say, Sarah, come over. Just
Hmm.
for instance, hypothetically speaking, they say, Sarah, come over, but that person has dengue, But they're gonna tell me that Sarah's only mosquitoes can pass it. If I go over there, no, I'll be at risk because if a mosquito bites you and then bites me, I
Hmm.
can become infected.
Hmm. And then remember, the Aedes mosquito tends to bite early morning or late in the night. So in the day when you go over, they might stay hidden, but if you're there long enough, the mosquito will come out and bite, because that's when it prefers to bite, early morning or very late in the night. There have been maybe one and few instances where they said that the dengue was transmitted from a mother to an unborn fetus, and
Whoa.
even there are instances, one instance I read, where they said that it was transmitted in the breast milk, but because it
Mhm.
is so rare,
Yes,
breastfeeding is still recommended in mummies who are suspected to have dengue, because the benefit to the baby outweighs the risk of transmission.
right. So long
It
and
is so
short of it,
rare.
yes. So long and short of it is if you have dengue, isolate yourself kind of really, right? Isolate yourself. You don't have to be going all over and say, oh, it's only mosquitoes. Because mosquitoes can be anywhere, I just bite you and then just transmits that mosquito thingy, that dengue. It will transmit it, don't?
Right, and some of the times we have breeding sites and we're not even so aware. So
Right.
even your flower pots, sometimes you have some containers in your yard,
Mm.
even in a bottle cap. The mosquito can, if there's water in there, the mosquito can lay eggs in there. And the larvae of the Aedes aegypti are so resilient that
Mm.
even if you get rid of the water sometimes out of
Yes.
the container, the eggs might still be there and still be surviving and just waiting on more water to accumulate. So
Mm,
that's why
so,
when you empty out the drums or the barrels, you have to turn them upside down as well so that water doesn't reaccumulate.
whoa. Now, are there any anti-dengue drugs or vaccines?
There actually is one that was developed in 2022,
Mm-hmm.
and they are trying it in some of the regions, for example, like in the Pacific and in Hawaii and so on. Hasn't gotten to Jamaica as yet, but once again, that vaccine is not everybody's not a candidate for that vaccine. I believe it's called the. Let me see if I can just remember the name in the
Sure,
meantime.
no
But
problem.
that vaccine is only for persons who have had dengue virus before.
Oh, okay.
Right. So
Right.
what it does is it prevents you from getting a severe illness if you're infected again. However, persons who have never been exposed to dengue are not candidates for that vaccine because it will make them get a very severe form of dengue. So persons who are going to receive that vaccine have to have their dengue test done to document that yes, they have been exposed to dengue in the past and have recovered. And it's actually called the dengue vaccine, and it
Then
protects you against all 1 to 4 serotypes, but it's not being widespread. It was just rolled out, so they're still learning more and more about this
about
vaccine.
that. Whoa, whoa. So it's only the vaccine, that you guys have. You don't have antibiotics and those things for that.
Well,
Dengue.
because it's a viral illness, antibiotics are not recommended unless the person has a superimposed bacterial infection. So
Oh,
for normal dengue fever with just headache, fever, muscle pain, the mainstay of treatment is supportive care. So that would be antipyretic in the form of acetaminophen, commonly
yeah.
known as Panadol or acetamol, to help with the high fever and the muscle pain. The person also needs to stay hydrated, drink a lot of fluids because with the vomiting and so on and the high fever, you tend to
Mm-hmm.
lose a lot of water that way. So you don't want the person to get dehydrated
Irritated.
and also bed rest. So the management is mainly supportive. If the person starts to have warning signs of dengue, then they have to be monitored in a hospital setting
Mm.
where labs can be done to check for the organ involvement that may occur with severe dengue. For example, they may have some amount of liver dysfunction, you may have fall in your platelet count, you may have the blood becoming concentrated, severe dehydration, blood pressure may start to fall, and all of those things will require close monitoring in the hospital and even sometimes an ICU setting if it gets that bad.
Wow. My goodness. Now, could you repeat the names of the pills you mentioned? I know it was paracetamol
Mhm.
and another one.
Acetaminophen,
Accept.
cetamol.
Okay.
Those are the only recommended antipyretics in dengue. Um, because NSAIDs, things like Voltaren, ibuprofen, cataflam,
Yes.
and aspirin, of course, is contraindicated in dengue fever because it might precipitate the bleeding complication that can happen in dengue. So we tend to avoid all of those.
So don't use Voltaren and those things. Just use what you said, the cetamol and the Panadol and all right. Okay. Okay. Now, you just mentioned the platelet count. How can we increase the platelet count, Dr. Anika?
Okay, so sometimes in dengue fever, and dengue with warning signs, of course, the platelet count will fall, and this is because the dengue virus is affecting the bone marrow. So it's causing the cells to not be produced as rapidly to replace, and it also causes some breakdown of platelets in the blood. So it can make the platelets low, it can make the white cell count low as well. In terms of increasing the platelet count, there is not really much to be done apart from hydration, getting lots of vitamin C, ensuring that you're getting your fruits and vegetables in.
Right.
Um, that's the only thing that we recommend for persons to do, and just to return to the hospital or the health center for monitoring of the platelet count. I have seen a few persons mention things like papaya leaf and so
Oh,
on in terms of helping the platelet count, but
mm,
those things have not been studied in clinical trials.
right.
I formally recommend that.
Okay.
Mm.
Okay. All right. Now talk to us about, measures that we can take to prevent dengue.
Mhm. So one of the fundamental things that we have to do is to take a look at our own yards and try to get rid of any mosquito breeding sites that we may have. So sometimes persons have bird feeders in their yard, they're not changing the water regularly. The stagnant water can become um, a wonderful place for the Aedes aegypti to lay her
A
eggs.
wonderful place. Okay.
So we want to try to ensure that we're not keeping any stagnant water in our yards.
Yes.
The empty tires, the tires that we have laying around, can
Mhm.
accumulate water as well. Sometimes, if we don't keep our yards nice and clean, to keep the grass nice and low, it can also prevent a nice area for them to reproduce in.
Yeah.
Also, the use of mosquito repellent that contains DEET is also very good at helping to ward off those mosquitoes. If you can use mosquito netting on your grills or your windows and sleep under a mosquito net to help to prevent the mosquito from coming into your home, sleeping under a mosquito net, wearing long sleeve clothing, those are some things that can help. But Jamaica is an area that is endemic for dengue, which means
Right.
that dengue is always present, sometimes in low amounts, generally in low amounts, and then sometimes you have that spike at a particular time of year. So it's something that we all have to get used to, constantly just preventing dengue, getting rid of our mosquito breeding sites, and setting up our homes so that it's not pro dengue, but more preventative for dengue.
So we need to get rid of all of those wonderful breeding sites for the mosquitoes. So don't harbor them. If you must, have your water. I don't know. I know some people they have drums of water
Mm-hmm.
so that they say that you can put oil
Pour oil on top of
top
it,
of it,
right?
right, to prevent the breeding of the mosquitoes and weird nets. Mosquito repellents, yeah, repellents, they must have deeds. If they don't have deeds, we can't. That don't make sense, right?
Tend to be not as effective
All right,
without the deeds.
not as effective. So it sounds like it's kind of still effective, but not as effective as the ones with deeds. Mosquito nets, mesh up your windows, your doors. Wear long sleeves in the night and cover yourselves, right? Just be careful and everything. Drink up your water, eat your vegetables, your fruits, vitamin C, all of those things. Paracetamol you take if you feel like you're getting those symptoms, and if it's
And
getting
of course, one takeaway, if somebody is having any severe symptoms of dengue, like we had mentioned, the
right.
bleeding, the persistent belly pain, persistent vomiting, if you have a child at home who is just not active, just lethargic, seem to be dehydrated, you might see their eyes sunken. This is not
Mm-hmm.
somebody that you want to keep home and just give Panadol. That's somebody you want to definitely bring to the hospital
Hospital.
to be evaluated by a professional.
Wow, wow. Now, as we wrap, I think we covered everything. Right, we did. Did we leave out anything else? Try to see. I think we covered everything. Can it be cured?
Dengue is a self-limiting illness. So most persons who come down with dengue, by 7 days, maximum 10 days, they'll be back on their feet again. So the body is going to fight it off, just like the common cold,
Yes.
just like the flu, unless it is that, it becomes complicated where you have
Mm.
dengue with warning signs, or, but those tend to happen maybe in 1 or 2% of persons who contract dengue. For the most part, persons will get better on their own with just supportive management.
Okay, all right. Well, I think we've covered everything now. Right, Dr. Annika Blake. Thank you so much for educating us on dengue. Dengue fever is going around now, and we just have to be cautious, vigilant, and do the necessary steps to prevent, this. Prevention is better than cure, right, Doctor?
Prevention is always better than cure. Exactly.
Wonderful. So please remind us, where are you located, and how can we contact you guys if we need to visit you?
Okay, I am located at Beta Medical and Wellness Center, which is Suite 1, 11 Marriott Street in Spanish Town. And we are a doctor office. And we actually cater a lot to our senior citizens,
Mhm.
where we have a special on Fridays where the price is discounted for the visit, only
Mhm.
1,500 for persons who are seniors with proof of identification. Yes,
Wow.
so we have found that a lot of the time seniors maybe have some serious financial constraints,
Yes.
so we want to facilitate them as best as possible.
That's wonderful. Is there a contact number you can leave us with?
That would be 812-8232.
812-8232. All right. So for those who are just grabbing their pens, I'm going to repeat it for you. 876-812-8232. Thank you so much, Dr. Anike Blake, for sharing with us on dengue. So we got everything that we need to know about dengue on dengue. So thanks again. Thank
Thank
you.
you so much for having me. My pleasure.
No problem. Blessings. All right, children of God, remember to stay safe and keep it locked to Love 101 FM, the family station. Thank you so much for listening to Body Talk. Bye for now.